with Will Cheesebro talking about his daughter, Riley. They live in Steamboat, Colorado. Can everybody welcome Will?
All right, can you guys hear me all right? Bear with me here. This computer crashed on the flight over yesterday, so I had to rewrite this last night. And I have only rehearsed it once, and it was about 30 seconds ago. Hi, my name is Will Cheesebro, and my wonderful wife Becca is sitting back here in the corner. Our 6-year-old daughter, Riley B., has SLC6A1. Riley was a pretty easy baby at the start. But after about 4 months, Becca noticed concerns with Riley not bringing her hands to her mouth and odd movements or looks that seemed seizure-y. Beyond tonic-clonic seizures, we really didn't know what we were looking at. I honestly didn't know that tonic-clonic seizures were called that. These observations were brought up at her 6-month checkup, and that brought us to our first trip to the Denver Children's Hospital for some testing and an MRI. Nothing really materialized from that. And over the course of the next 1.5 years, all things Riley started crumbling. Her feedings got a lot harder. The transition to food was brutal. And the sleep. What sleep? Becca was a warrior with the lack of all the sleep. We tried everything we could, and it seems like things were getting worse and harder somehow at the same time. So much screaming, so much crying. Riley was going through therapies, early intervention, OT, PT. These things were helping with gross motor skills and bringing her hands and use of her hands. But the progress was not keeping up, and there was still something that seemed off. At her 2-year checkup, her pediatrician asked how the autism screening went. It hadn't. We were still on a wait list for what had felt like a decade, calling every month to ask what the update was, and there was never one. A couple doctor calls later, and we had an autism screening and a sleep study scheduled. So off to Children's for an overnight we go. Riley gets her autism diagnosis just after she turned 2, as well as a global developmental delay. Hooray, we did it. We had something. This opened up more testing, blood work, better therapies. And this is where Riley's journey hit a new gear for her and for us. About 1 week after that doctor visit, before any of the sleep study results are in, Riley had her first tonic-clonic seizure. See, I know what they mean now. There were 0 questions with these. They started around 8 o'clock in the morning on a Saturday. They came in sets of 2, lasting between 1 and 2 minutes, with 30 to 60 seconds in between, happening every 5 to 10 minutes. This led to an ambulance ride to the ER in Steamboat, and then a flight from Steamboat to Denver. These seizure waves lasted until about 7 p.m. that night. None of the seizure medications were working, and eventually Keppra broke the cycle that night in the ICU. After that, the rage hit hard. Our little girl was not happy, and she was not okay. After the seizures stopped that night and we were transferred to the neurology floor, we got a label of a fever-induced seizure event that was caused from a sickness that she got from her last hospital visit. And now that the seizures had stopped, and eventually she was able to keep food down, I couldn't tell you how many days that we were there. That time is no longer linear in my brain. We were sent home. No answers and a lot of questions. That is when her drop seizures started happening. They would happen all day, every day, hundreds if not thousands a day. She could not function. So we loaded back up, went to Denver with the intent of we're going to show them what we're seeing because we're fairly confident these are also seizures. When we got there, we found out that she had abnormal brainwave activity from the first sleep study. So we did another overnight EEG to see what was up. They gave us the little Jeopardy buzzer to hit every time we thought we saw something that could potentially be a seizure. They watched us in that room hit that button over and over and over again. Eventually they came in and said, "We're good on the button. We get it. We see it too." Since we were still waiting on blood work to come back, the plan was to treat her as epileptic, give her a seizure medication, which turned out to be clobazam, at a very small dosage. We stayed with family near Denver to monitor the seizures, not in a hospital setting, and see what would happen. Within 24 hours of her starting what is now, what I know, a very, very small dosage of seizure medication, the seizures went from hundreds to tens. She was running, she was playing. I saw light in her eye that I don't think that I had ever seen before. When the lab results came back a few weeks later, we got our official diagnosis of SLC6A1. What was that? Why is there nothing on the internet about this? A new chapter in Riley's adventure was about to start. Enter Amber Freed. What a force. Am I right? Riley started her seizure medication of clobazam in March and then started the Ravicti trial in July of that year. Riley has been virtually seizure-free since starting Ravicti in July, almost 3.5 years later. And that solved everything. The end. Right. With all the good things that have happened for Riley, there are still, unfortunately, more turns, twists, with a lot of bumps in her everyday struggles. They usually show in the forms of aggressive behaviors, epic tantrums, screaming, hitting, biting, scratching. We're really working on the biting. And overall frustration. Mood swings can happen at the drop of a dime, for no reason at all, or for all the reasons. Outbursts can last 30 to 60 seconds, or 20 to 30 minutes. It is truly unreal, the physical stamina that it takes to go that hard for 30 minutes for a little girl who's only this tall. She faces a number of issues in social settings as well. With personal space, she struggles with listening and taking directions from peers or teachers or parents or anyone. As she grows and outgrows her dosages, these struggles can become more intense and more frequent, leading to be able to not participate in school or play or just everyday life activities. It feels like we are only treating a small part of what Riley has going on by handling her seizures. We are now the parents who take pictures of ourselves when we have bruises, scratches, cuts on our bodies or on her older sister MJ's. Riley unfortunately hears the words no, don't, and stop all the time, usually from myself or Becca, because we are trying to just rein her in and keep her functioning at a decent level. She's so happy in the moments that we call clarity, where it appears where everything lines up for just a sliver, sometimes 30 seconds, sometimes 60 seconds, 20 minutes. If it's an activity that she's excited about, it can be hours, but also sometimes not that. There are no easy days with Riley. Some are definitely harder than others, but never an easy day. It is even harder to be away. The fear of what might happen that either myself or Becca could maybe have prevented. It broke my heart when I started to write some of this, because I truly dislike harping on how hard she has it and how unfair it is for her. But it is also very freeing to say it out loud. Just because I don't like it doesn't mean that it isn't true. The grit and determination that my daughter has is beyond inspirational. She has the greatest attitude for someone who struggles 24 hours a day. And I'm so beyond proud to be her dad. I would like to finish by saying that our family would not be in the situation that we are in, and I consider that to be a pretty good one, all things considered, without the people in this group, Amber Freed, Kim Fry, and all the people that are members of this group that were not able to make it. Thank you for fighting with us. Thank you for not taking no as an answer. We greatly appreciate it. Thank you.